Yeah, I'm back. It's King Flex.
I am a community health worker and I work for Island Health, supporting clients in the community. So we go into their private homes and we do their care. These are people who typically would either be in hospital or they've just been released from hospital because of operation or any kind of procedure, or they're choosing to stay home for whether they're palliative or they just need support to be able to stay at home for quality of life. And so that's what we do. And I get to be part of that team, go into the home and make their days better.
I often hear from staff that when they start their visit with a client, the client might not be having a very good day. And by the time they finish, the client's smiling and feeling a lot better. Most of the resident carry courses are 7 to 8 months. And that includes classroom work and then practicum experience, which is really, really good. And practicum experiences often include facility work, like a long-term care facility, and also community, such as home support. So it's pretty nice, 7 to 8 months worth of studying, and then you're put to work.
I came into healthcare later in life. So when I was very young, I wanted to be a nurse. I didn't do it. I didn't go to a university. It was too expensive and life just happened and I had children and carried on. When the opportunity arose that now I could have a career in healthcare, it was affordable. It was a 10-month course that included my practicum and I had a job at the end of it. Whether I want to keep going on, take further education, become an LPN or an RN. But right now, I love being a community health worker. Coming to Island Health is like coming home. I always say it feels like I step back in time. It's very community-minded and very supportive, very flexible and supportive to what our needs are as a worker and how we can work around family life or children or whatever. And yeah, I love it.
You get to see the clients so much and on more of a personal level, probably with the one-to-one and quality time, which is something I hear often.
We're going to them. So most people feel safer in their own home. They're happier to be in their own home. It can be scary to be in a facility. You're away from your pets, you're away from your loved ones. In the home environment, they're already in their comfort zone and they're inviting us in as guests. And we're doing the best we can for them. So we generally have people who are comfortable. They're comfortable with us because they're comfortable in their surrounding. And so then they're usually open to care. It's usually a rewarding experience for sure.
I look for people who are personable because it's good to be able to hold a conversation and like to talk with people and hear about their stories, clients' stories. Caring, compassionate, kind, patient, and probably a really big thing that we look for is the ability to be flexible. Never the same day twice. People change often that you see, and being flexible to different shifts that are available within the healthcare system. That's probably it in a nutshell.
Healthcare is very meaningful work. I think you have to have a certain personality. You have to love people. You have to really care about people. It's very rewarding. You feel very good at the end of the day, like you've made a difference in your community.
I work with a large number of teammates that started as a community health worker or a nurse's aide, resident care aide, or home support attendant, and went on to be an LPN, and then went in to become an RN, and keep moving on, whether it's into management or there's so many opportunities within healthcare. So becoming a resident care aide is actually an excellent stepping stone for someone who doesn't know quite maybe what they want to do, but it gives them a good taste and a good introduction, and it really serves as a stepping stone and exposure to what might lie ahead.